Tell us a little bit about your day-to-day work.
Well, as a nurse, which I retired from a few years ago, I actually worked in a urology office doing many procedures with a variety of patients.
Um, do you know Spanish? And if you do, how much? Or did
I
you?
have very little knowledge of Spanish. I took it in high school, which was years and years ago. Muy poquito.
Have you found that it would have been helpful to know Spanish?
Yes, especially in today's environment, I think it's absolutely essential that any healthcare worker, matter of fact, I think anyone that deals with the public, not just healthcare workers, should know Spanish.
Can you tell us about a time in your position where it would have helped to know Spanish?
I'm actually going to tell you a story that occurred years and years ago when I was a student nurse in Hartford, Connecticut. And I think it's a good example of how our society has changed. Hartford Hospital was a large urban hospital. Can't remember how many beds they had, but it was quite large. And one evening, working there as a student nurse, there was a need for a translator in Spanish. And there actually wasn't anyone in the hospital at that time, I'm talking in the early 60s, who spoke Spanish. And somehow they found out that I had taken Spanish in high school, not in college, and they came and recruited me to go and talk to a patient who had arrived in the emergency room with abdominal pain. So I did the best I could. I was not fluent in Spanish, but at the time I did have a working knowledge of the language, and I think I helped them, the healthcare providers, and the patient in that one situation. And it's always stuck in my mind that was rare at that time, and now it is so commonplace that we know the necessity of having translators.
What phrases did you use to help that person?
Well, at the time I knew phrases like, where is your pain? Do you have a temperature? When did it start? How long have you felt badly? So I think I gave the doctor who was actually checking the patient some kind of feeling about how long it had been going on and where exactly was his pain. So I think I did help.
And how easy was it to access a translator?
Of course, over the years it's become easier to access a translator. At that point, there were very, very few, which to me is kind of amazing because I think a lot of the janitorial staff at that hospital were Puerto Rican, and which meant they knew Spanish. Hey.
That's it. Thank you.